Good afternoon. I'm George Latimer, Westchester County Executive, and this is our 2 o'clock Westchester coronavirus update. And I'm very happy to be here in the Mayor's Conference Room at Mount Vernon City Hall on Roosevelt Square in downtown Mount Vernon as a guest of the Mayor of the City of Mount Vernon, the Honorable Sean Patterson Howard. And Madam Mayor, thank you for hosting us here, and we're very happy that you're here for the update. Tell us a little bit about what's happening here in the City of Mount Vernon as you go through these difficult but challenging times.
So I just really want to say thank you, County Executive Latimer, to not only you, but your entire executive team. You have been partners with us from the beginning, whether it was helping us secure personal protective equipment and Tyvek suits that you work with our police and our fire department, to sharing some of your protocols. And today you are here because you've given away several thousand masks with us today to our faith-based community that were supplied by the county. You've worked with us on enhancing our food distributions and making sure that we're able to provide food to the general community as well as our seniors. And so it's been a very good partnership from the beginning. Mount Vernon's been hit hard. We have over 2,500 cases, but we're down to less than 250 active cases right now. And we have stood up several testing sites. Today, Grace Baptist opened as a testing site, not only for COVID, but also for antibody testing. Mount Vernon Hospital now has a walk-in without appointment testing site from 8:30 in the morning until 7:30 p.m. And we still have our testing site over at the Mount Vernon Neighborhood Health Center. So as we continue to try and see and make sure that we are reducing barriers to testing for the community, we also want to make sure and go back and capture those who might have been COVID positive but never had an opportunity to get a test or never displayed symptoms by doing the antibody test. So this is good work. And we really look forward to working with you and your administration around reopening Westchester and reopening for business. And we have to, as you've always said, balance the public health need with also reopening our economy. And so these are things that we look to develop protocols along with you that are safe, that are responsible, and fiscally responsible, health responsible and fiscally responsible.
I know I've got to go in a second. I just want to ask you one more question. Mount Vernon is a tough and resilient city. What do you get out of the experience of Mount Vernon residents as you lead them through this moment?
Well, I mean, what this has shown us as Mount Vernon is something that we've known. Like you said, we are a resilient community. And unfortunately, over the last few years, we've had a lot of political divisiveness happening, but we've been able to come together across departments here within city government. We really use this as an opportunity to quickly break down silos, to build greater partnerships with our faith-based community, with our business community, different industries, with our civic associations and neighborhood associations. Crisis hits and people come together. You do it in families, and that's what Mount Vernon is. Mount Vernon is a big family. And so this has been a great opportunity for us to kind of put aside some of the pettiness and really focus on bringing this community together to address these challenging issues that are at hand right now. So it's been a hard time, but it's reminded us of who we are.
Madam Mayor, thanks very much. I gave you the official elbow bump.
Thank you so
we
much.
Can have an appropriate socially distanced congratulations. Thank you.
Thank you.
Thank you for hosting us here today.
Absolutely. Have a good day.
We're very appreciative. Thank you. That's Mayor Sean Patterson Howard, Mayor of the City of Mount Vernon. And we're very happy to be here in her community to give you today's 2 o'clock update. The information today will be fairly straightforward. Just to give you a few numbers and get you up to date with where we are, then answer any questions from the press that may be, may come forward from the press. Catherine Chaffee is with us here today, our Director of Communications. We also have a variety of our other key people. Carl Pagano is here, Ellen Hendricks is here, Crystal Collins is with us, and Ken Jenkins, Deputy County Executive, was here as well today. The total positive number for Westchester County is up to 31,611. That's a fairly small increase over the last few days. And when you factor out that 28,626 people were tested 2 weeks ago, we have now gone under 3,000 active cases in the county, 2,985 active cases. Again, at a peak of 11,000 cases now, to just under 3,000 cases, 2,900. That is good news. The hospitalization number is down under 500, 498. That's good news. That was as high as 1,200. Our death total has risen to 1,245. We lost 7 individuals last night, and that is always a tragedy, but the numbers on our deaths have been very small now the last few weeks, week and a half, 2 weeks, and we hope that we're all reaching the point at which we can satisfy the state's parameters for beginning the process of opening what we're dealing with. Today we were here, as the mayor of Mount Vernon said, to give out masks that were donated by the Greater New York Automobile Dealers Association. We want to thank them. Mark Scheinberg and his group that made the donation. We publicized that about 10 days ago. We were together. One of their members is a lifelong friend of mine, a fellow Mount Vernon resident originally, Augie DeFeo with White Plains Chrysler Jeep. And he is an example of a local Mount Vernon boy that's gone on to do other things and still benefit the hometown that he grew up in. And we're appreciative of all the donation of resources by the Greater New York Automobile Dealers Association. Those masks were distributed, as was mentioned, to Grace Baptist Church, Greater Centennial AME Zion Church, Macedonia Baptist Church, Mount Vernon Heights Congregational Church, and the Westchester Muslim Center. And the religious leaders of each of those institutions were here today to gratefully pick up that which they can then give out to the people in their community. We're continuing the mass distribution process across Westchester County. You've seen us do this in a number of other different locations, and we're going to continue that process, particularly targeting those communities where we've had the highest number of positive cases. We want to make sure that we're reaching the people that most need to help us stop the spread and continue the positive path that we've been on for a while. And I do want to mention that the Greater New York Automobile Dealers Association represents more than 400 franchise new car dealers in all 5 boroughs of New York City, on Long Island, Westchester, the Lower Hudson Valley. So again, there's 12 county region that they have shared that generosity in across the board. Also, as the mayor just mentioned, there are a number of places for you to get tested for COVID here in Mount Vernon, where we are today. Mount Vernon Neighborhood Health Center on East 4th Street is a location for testing. Grace Baptist Church, which Governor Cuomo announced over the weekend, has opened up their testing facilities at South 6th Avenue between 1st and 2nd Street, and Apple Med Urgent Care, 504 Gramerton Avenue in the Fleetwood section, is also open for various testing purposes here in the city of Mount Vernon. There are those kind of sites all across Westchester County. And as we travel the county, we've done this in Peekskill and Pleasantville, and Portchester, and a few other places as well. We'll continue to highlight what those local circumstances are. We want to mention that, as we did yesterday in some great detail, the region that we're in, Westchester, Putnam, Orange, Dutchess, Rockland, Ulster, and Sullivan counties, are within 5 of the 7 categories that the state has set down necessary for reopening the business and the economic engine of the county. We're looking forward to making those goals over the next week, hopefully sooner, hopefully not too much later than that, which will allow us to go into phase 1 opening, which would be a certain segment of the economy, and then we go in various stages up. Some of the upstate counties, part of regions that were much less hardly hit by COVID, also representing more sparsely populated areas, will be opening over the course of the weekend, and we hope that in due time we put this contagion behind us and try to reestablish where we were prior to COVID extending itself across our state. I want to highlight that we are still in the middle of census collection data. It will go on until October 31st, and a number of communities have already passed their 2010 census goals. Croton-on-Hudson has, Lewisboro has. There's another 4 or 5 communities that are within a few percentage points of exceeding what they did in 2010. We have in Mount Vernon and Portchester communities that still have to move up the line quite a fair bit. I had the opportunity in the last 2 weeks to speak to the census committees over this mechanism, Zoom, both in Portchester and Mount Vernon, to go over some of the efforts they're making, and along with Yonkers, Elmsford, a number of other communities, we're making a full-bodied effort to try to help everybody register for the census and get an accurate count of Westchester residents. In addition to the state opening guidelines, which are on everybody's minds that we're trying to achieve, I want to make sure we highlight for you that the Ribbons of Remembrance program continues and will continue throughout the extent of this contagion. down at Lenoir Preserve Nature Center that's located in Yonkers that overlooks the Hudson River and is a place for you to go, fill out a ribbon, remind yourself and others of the person that you lost to COVID, tie it to one of the trees in the grove, and show respect, which we all want to show for all of those who we've lost. So it's a very brief update on the substance of it. Antibody testings continue. We have hit over 2,000 mark through yesterday. I think we'll hit the 2,500 mark as we go through today. We'll continue to move forward. We're doing that at the county center in conjunction with the Westchester Medical Center. They are both administering the blood taking portion of the test and also processing it in their labs. And we're very appreciative to Westchester Medical Center for that. With that, we're going to turn to Catherine Chaffee, take any immediate questions we have, try to answer them as succinctly as we can, and then help you get on your way for the day.
Sure. The first question comes from the examiner regarding hitting all of the state's metrics to enter phase 1 reopening. Looking at today's updated dashboard, the Mid-Hudson region currently has only 3 consecutive days of declining deaths and far exceeds the five deaths. Is it your understanding that that would mean that we have at least another 11 days before the region can begin phase 1?
Well, it said 14 consecutive days, and if the state has indicated that that 3 days accounts to that end, then yes, it would mean 11 days are ahead of us. We're going to ask the state to drill down through the data. We had a spike in deaths in Westchester County a week ago last night. That was an unusual number. It jumped out as an irregularity and may have been a combination of data that was not easily available and therefore was used on one particular night to catch us up to what the right total number of deaths would be. If that number is a factor for why we've only gone a few nights, then we'll double check that and perhaps we can get a reassessment of it and rechange that demographic evaluation. We believe that we've shown a steady decline in deaths. If in any individual night it bumped up a short period of time, that is supposed to be taken care of by doing a 3-day rolling average. I certainly know that Westchester has been reducing in the number of overnight deaths. I'm obviously not familiar with what's happening in the rest of the counties. They each track their own numbers. But I'm hopeful that with the revaluation, we can get a reassessment and we're closer to our goal than 11 more days. That's the only question we had. So anybody in the press that wants to reach out to us, they're welcome to do that. They can contact Catherine Chaffee, 995-2932. We'll be happy to have discussions on any of these topics. It is both how we're handling the contagion, what are we doing with county services and functions during this period of time, how we're trying to help our local communities with various tasks that they have, and then how do we go forward with county functioning in the reopening of society, and then ultimately dealing with the large budget gaps that have been triggered by the loss of revenue in COVID. But all of these things are things that we have to work on every single day. We'll report to you however long or however briefly every single day. And with that information, you'll be a little bit better able to assess how things are going here in your backyard of Westchester County. I'm George Latimer. Thanks for tuning in. Tomorrow at 11 a.m., we'll do another Facebook Live interview. And we'll be back again tomorrow at 2 o'clock for another update of status here in Westchester County. In the meantime, stay safe.